Hi guys, welcome back to Code Master Coach, your medical coding tutor. Guys, today I just wanted to come to you and share with you a little bit about a presentation that I did for a local AAPC chapter in New York. I was asked if I would speak at their chapter meeting, and I agreed to do it, but I was trying to think, what could I possibly discuss with the group of my peers? And with everything that we've got going on in the United States, I started thinking about, why did I fall in love with medical coding to start with? Now, my students of Code Master Coach are probably laughing at this topic, falling back in love with medical coding, because throughout my program, as I'm teaching my students how to code, my number one saying is always, love your code book and it will love you back. Because I feel like in the profession of medical coding, there's so much to learn. There's so much to cover. And so I always tell my students coming in, think of your training as you're learning medical coding as you would a new relationship. And when you're in any new relationship, you want to spend time, you want to get to know the person, and eventually fall in love with them. Well, that's what I want my students to do as they're learning medical coding. I want them to get their books. I want them to spend time in it. And then I want them to learn to love medical coding, because the more time that you spend in your books and the more in love you are with your books, you've got it. Those books will love you back with the correct answer. So that was the topic that I chose when I spoke to my peers in New York City. The topic was falling back in love with medical coding. And I started off by telling them I wanted to share with them my story. What happened to me and what made me fall back in love with medical coding. Because I feel like coders today have been through so much, especially with the pandemic. A lot of jobs shut down. A lot of companies closed. But think about it, the physicians' offices, the emergency room, even the hospitals were crowded. They were busier than ever. And who had to code those claims, or those office visits, emergency room visits, and hospital visits? Who had to code them and prepare those claims so that these organizations, these facilities could get paid? Medical coders. So a lot of us got burnt out during this time. We are worn out. We're tired. If patients couldn't go to the physician's office or the emergency room, they were doing what was called telehealth visits. Those visits had to be coded as well. So medical coders, we were busy. So I know we're tired. I know we're burnt out. But I just wanted to remind my peers when speaking at this local chapter to fall back in love with medical coding, because it was our love in the beginning. Fall back in love with it. So as I was sharing my story with them, I started off by saying that now with my situation, after being in the health information management profession for a little over 20 years, I found myself lost. That's what happened to me. I got lost. I felt I was in a rut. Work became mundane, day in and day out, doing the same thing over and over. I went to work, I did my job, and I went home. That's how I felt after a while of doing coding over and over, and even in my profession. So I guess you guys are saying, Coach, what did you do? Well, think about my situation. When I first completed school, and after I obtained my RHIA, I went for the 4-year degree in health information administration. I was excited. I couldn't wait to get in the profession. I immediately applied for a director position in HIM. I had no experience, just school, but I was determined to do it. Because see, right after school, they usually tell you, don't go for the director position, work your way up. No, I didn't listen. I wanted the director position. Luckily, a position about an hour away from my home was looking for a director of HIM. And that new director would work under the previous director for 3 months before that director would leave. And then this new director would become the director of HIM. I couldn't ask for a better opportunity. I got the job. It was a small 50-bed facility. It was an acute care setting, and it was in a very small town. I came in running because, again, I knew right out of school I wasn't supposed to be going for a director position. I was supposed to work my way up. Even my classmates were looking at me like, a director? Come on. And within 2 years of working at this job, the local state technical college was looking for clinical sites. And so I started allowing the HIT students to come through my department to train. And then I was eventually asked if I would teach classes on the management side of the college in their health information technology program. So I worked at the hospital from 8 to 5 and the college 2 nights a week from 6 to 10 p.m. And then I moved from acute care to rehabilitation for the experience, and I loved it. I loved it. So when the program director position for that state technical college position, when she resigned, she recommended me for her HIT program director position. So now I had the opportunity to teach full-time in an associate degree program in health information technology. And I did this for 11 years before getting married and moving. So after getting married and I moved, I went back into a director of HIM position at my local hospital, and I was supervising release of information, assembly and analysis because it was still paper records then. I had file clerks, medical transcriptionists, and medical coding. But there was a whole lot more to directing an HIM department than the roles within the department. I found myself wrapped up in I call it bureaucracy of healthcare as well. And in an additional hat, HIPAA privacy officer was also added to my role. And before long, I found that I had lost my coding skills. I had lost it for the management side of healthcare. I was so wrapped up in managing and watching claim submission and dealing with HIPAA and physician medical staff privileges, the whole director of HIM side, that I lost my coding skills. But ultimately, money was the biggest concern for the healthcare organization. The hospital was more worried about money. I managed the medical coders in my HIM department. These medical coders were responsible for capturing the codes for the services that were rendered so that the organization could get paid. But guess what? I had lost my coding skills because I did not stay current. I had medical coders looking at me for guidance, for direction that I couldn't give them. The business office manager had even come to me and asked me if we could bring emergency room coding that had been previously outsourced before I had taken on this job, if we could look at maybe bringing that ER coding back in-house. And I wasn't even sure how to answer that question. I did not know where to start. Sure, I faked it for a little while, but I got tired of faking it. That was a heavy burden to carry. So what did I do? I buckled down, put myself on a strict 12-week study schedule, prepared for and passed my CPC exam. Passing the CPC exam motivated me and gave me the confidence that I needed to keep going. And I prepared for my CCS exam. And guess what? I passed that too. In the process of studying for these exams, I created my YouTube channel, Codemaster Coach. This helped and also held me accountable by others to keep going because I found pleasure in creating lesson plans of the official coding guidelines as I studied and prepared for the test. And so those were my earlier videos. As I would learn the material, I would study for the test. I'd prepare these lesson plans. I'd share it on here on my channel. And so I just really got excited and really buckled down and learned medical coding. So my question to you today is, do you today have the same desire and drive to learn and stay current with your medical coding skills as you did when you first got in the profession? Why or why not? Where are you in your job? We tend to lose ourselves in everything that we do. For example, with marriages, between spouses and partners, we like what they like. With our children, we accommodate our children over ourselves. A medical coding career requires a lot of work. We must stay current of added, deleted, and updated codes. Look at all the buzzwords out there. The new CPT E&M for office and outpatient setting. Information governance with the EHR. And even medical billing and reimbursement changes. There's so much we've got to stay on top of. So, do you go to work each day to do a job for someone else? Or are you going to work for you? I'm not asking if you're an entrepreneur. I'm not asking if you're in business for yourself with your own coding company. Even if you code for a hospital or a physician's office. I'm asking you, even if you work in some other type of organization, are you working to improve you? And improving yourself can come in many different forms. Take it from me, someone with 2 parents with Alzheimer's and dementia, my father and my mother-in-law. I can't stop because I fear dementia. So I keep going, and it keeps me strong. What about you? What are you doing on your current job, if you are currently a coder, to keep yourself going? And how can you improve at what you are doing? Remember, the best investment you can make is to invest in yourself. Increase your skills and acquire more knowledge. Do you take notes of areas that you need to research on your own time to become better at your job? So many of us wait until our employers send us to workshops to get information. As medical coders, we're researchers. How can we take our research from a should mentality to a want to mentality? I should be doing this, or I want to continue my education in medical coding. Start small with maybe a topic like telehealth. COVID-19, during this pandemic, telehealth has come to the forefront of medical coding. Build from there to maybe a lesson plan. Research different sources like Google, AAPC.com, ahima.org. Do what you can, because remember, little actions add up over time and compound into big results. Because remember, doing nothing gets nothing. So anything is better than nothing. Don't self-sabotage. Let me repeat that again. Don't self-sabotage. If you can devote just 30 minutes a week, that's better than nothing. 30 minutes a week. Read your AAPC journal, Healthcare Business Monthly. Pick a topic to research each month. Take a class. Do something for yourself. Do you think medical coding is going to wait until you're ready to move? Take it from me. It doesn't. If we become dormant, we will get left behind. How open are you to learn or increase your knowledge for your job? Are you excited to go to work? That could be the answer to that question. Are you excited to go to work? And when you complete your work, do you see your touch? Think about that. Think about those questions. In my next video, I'm going to be talking about little habits that you can start today to start improving your coding skills. Fall back in love with medical coding, guys. Fall back in love. I will be starting a small class, another cohort of students, on June 14th. If medical coding is something that you're interested in, email me at codemastercoach@gmail.com. Again, just a small group because summer is coming. A lot of you will be doing your summer vacations. Your kids will be out of school. But at the same time, I've got others that have worked year-round and they have the summer off and they want to start taking classes this summer. So I'm going to just do a small class. I'm going to start a small class of students on June 14th. So if you're interested in learning medical coding, be sure to email me at codemastercoach@gmail.com and let's get started on your coding career. Again, fall back in love. If you're not already a medical coder, let me teach you how to fall in love with medical coding. Okay, guys? Thanks. I'll see you in the next one.